Hey everyone, welcome back to Money Steam. Today we're diving into one of the most confusing topics out there, Medicare versus Medicaid. If you've ever found yourself wondering which is which, don't worry, you're not alone. They're just two letters apart, but the programs are actually very different. Let's clear up the confusion so you'll never mix them up again. Ready? Let's get into it. What is Medicare? Medicare is a federal health insurance program for people 65 and older, as well as for those with certain disabilities. It covers things like hospital visits, doctor appointments, and other medical services. The best part? It doesn't matter how much money you make, it's all about your age or your disability status. But here's where it gets a little complicated. Medicare has different parts, each covering specific healthcare services. Let's break those down. Part A covers hospital care, skilled nursing facility stays, hospice, and some home health services. If you or your spouse have worked and paid Medicare taxes for at least 10 years, you won't pay a premium for Part A. Part B covers outpatient services like doctor visits, preventive services, medical equipment, and some home health care. Part B comes with a monthly premium, and you may also have to pay deductibles and co-insurance. Part C, also known as Medicare Advantage, is a way to get Parts A and B through a private insurance company. These plans often include extra benefits like vision, dental, and hearing, but they have specific networks and rules. Part D is all about prescription drug coverage. It's an optional plan that helps cover the cost of medications. As you can see, there's a lot more to Medicare than just signing up and being done with it. You'll likely need to choose which parts to enroll in, and there are some costs involved, depending on your coverage choices. What is Medicaid? Now, Medicaid is a bit different. Medicaid is a joint program between the federal and state governments designed to help low-income individuals and families. It helps cover things like long-term care, personal care services, and even assists with Medicare premiums if you're also eligible for Medicare. Here's where Medicaid stands out. It's more of an aid program than insurance. It helps cover things for people who might not be able to afford them on their own. But Medicaid isn't the same in every state. Since states have control over their own programs, the benefits, eligibility requirements, and costs can vary. So what kinds of things does Medicaid cover? The federal government has a list of mandatory benefits that all states must provide, such as inpatient and outpatient hospital services, doctor visits, transportation to medical appointments, nursing facility services, home health services. Some states also offer additional benefits like dental, vision, and physical therapy, but those are optional. That's why if you live in one state, your Medicaid coverage might look different from someone in another state. By the way, most of our viewers aren't subscribed yet. If you're finding this video helpful, go ahead and hit that subscribe button and give us a like. It really helps the channel and keeps us bringing you valuable content. Key differences between Medicare and Medicaid. Eligibility. First, who qualifies for each program? Medicare is primarily for people aged 65 and up, or those with certain disabilities like end-stage renal disease or Lou Gehrig's disease. Once you turn 65, you can enroll in Medicare during your initial enrollment period, a 7-month window that starts 3 months before your 65th birthday and ends 3 months after. If you miss this, there's the general enrollment period from January to March each year, but be aware that missing your initial period might result in late enrollment penalties. Medicaid, on the other hand, is based on income. If you meet your state's income requirements, you can apply for Medicaid whenever you need to. There's no specific enrollment period. Income eligibility levels vary by state, but in general, if your income is near or below 138% of the federal poverty level, you may qualify. Medicaid is available to people of all ages, including children, pregnant women, seniors, and people with disabilities. Coverage scope. Medicare offers standardized benefits across the entire country, meaning what you get in one state is what you'll get in another. Medicaid, however, varies by state, and its coverage is generally broader than Medicare because it's tailored to help low-income individuals and families. Medicaid can even cover long-term care services that Medicare doesn't. Cost to beneficiaries. When it comes to costs, Medicare works like traditional insurance. You'll have premiums, deductibles, and out-of-pocket expenses. Part A is usually premium-free, But Part B comes with a standard monthly premium, which can go up based on your income. Plus, there are copays and co-insurance for many services. Part D also has premiums and costs for medications. Medicaid, on the other hand, is typically free or very low cost for those who qualify. Some states may require small copayments or cost sharing for certain services, but many essential services like emergency room visits don't require any copay at all. Administration. Lastly, who's in charge? Medicare is run solely by the federal government, meaning it's the same everywhere. Medicaid is a federal-state partnership, which is why you'll see differences in coverage and eligibility from one state to the next. Choosing between Medicare and Medicaid, or both. Now that we've broken it all down, how do you know which one to choose? Or if you might qualify for both. For seniors, if you're turning 65, you'll want to get on Medicare. You can sign up during a 7-month period around your 65th birthday, which gives you plenty of time to figure out which parts of Medicare are right for you, whether it's just Part A and B, or if you need something extra like Medigap or Part D for drug coverage. If you want more coverage than original Medicare offers, consider adding a Medigap plan, which covers things like deductibles and co-insurance that Medicare doesn't. Or you could go with a Medicare Advantage plan, which combines hospital, medical, and sometimes even drug coverage in one plan for low-income individuals. If your income is on the lower side, Medicaid could be the answer. Each state has different rules, but if you're near or below 138% of the federal poverty level, you're likely to qualify. Make sure to have proof of income, like bank statements or pay stubs, ready when you apply. Applying for Medicaid can vary depending on the state you're in. You can usually apply online, over the phone, or through a paper application. Be prepared to provide documents like tax returns, medical bills, and proof of identity such as a birth certificate or social security card. Dual eligibility. Believe it or not, some people qualify for both Medicare and Medicaid. If that's you, Medicaid can help cover your Medicare premiums and out-of-pocket costs. In most cases, Medicare will pay first, and Medicaid will help cover what's left over. So, if you're eligible for both, make sure to check out programs like Medicare Savings Programs, MSPs, which help cover Medicare Part B premiums, and Extra Help, which assists with prescription drug costs. That's it for today's breakdown of Medicare versus Medicaid. I hope this helped clear things up. If you found this video helpful, hit that like button, and don't forget to subscribe to Money Steam for more content like this. Got questions? Drop them in the comments below. Thanks for watching, and we'll see you next time.